back to our discussions. I know, Alexander, that you wanted to share something following Dr. Nicholas.
Exactly. To further emphasize on what Dr. Nicholas said, we knew from prior to COVID what the adverse effects were of Pfizer. Now, this was exposed because the court forced their hand to expose their prior tests. From those tests, I can actually confirm that what Dr. Nicholas has mentioned is completely, we are on board 100%, because this analysis of this test, which covers 11 pages of adverse effects, in fact, I can show you a picture of it here, each page has 130 adverse effects. So, in fact, we as an association and groups were fully aware of what was to happen in the COVID rollout and the experimentation of these vaccines. Unfortunately, our government didn't take this information on board, and consequently, because of such lack of initiative, we have hundreds of people in hospital queuing up with serious problems. It could be from heart, it could be to liver, it could be skin, it could be related to pregnancy, mental issues, tumors, cancers. So if we were aware, why did not the medical institutions take this information on board and question what the rollout was going to eventually cause? So from that respect, I can confirm, if people would like to contact me, I can send this document directly to them. It's completely detailed, it's very technical, but in reality, everything is available. Everything was known. So the lack of interest from the government and the Ministry of Health, in my opinion, was catastrophic. I can't understand, really and truly, how the government has not taken a different stance, especially with this new treaty and discussions, not even dispute, not even question, not even suggest something new, not even question why the WHO has not actually tried to amend their mistakes. Because in my opinion, this is fatal. When the WHO should have seen this report, they should have flawed it and make sure that any new vaccine should have each vial tested for anything abnormal. Now, what they did here, Pfizer, they went a step further. When they presented this information to the authorities in America and they approved it, on the quiet, behind the scenes, they added more things that made them, in my opinion, although they have a clause of not being responsible, but responsible to the fact that they introduced SV40 and plasmid DNA from E. coli. So in my opinion, that further emphasizes why people today are extremely sick. So we can, or rather, I can conclude, to be honest with you, that we have to make sure we don't rush into another pandemic agreement, which in actual fact it isn't yet done, although the minister insists that there's a new deal on the table. There's no such thing because they haven't yet concluded. And till that point, we, as the public, because I'm here representing the public and no one else, there's no political structure, there's no, I don't represent either Labour, I don't represent Nationalists, but in reality, whoever wants to take political mileage on this can take it because people are getting ill. And the question is, why are they getting ill? And this is why, in my opinion, whoever runs with it has good, strong political mileage. No one wants to get sick at the end of the day.